Hello everyone, my name is Neha Danavle from Brisang Training Institute and I'm going to share this technical video on ICD 10. Uh, ICD 10 is the medical coding system that comes under this medical coding, and it is a 10th edition of International Classification of Disease. And this International Classification of Disease is mainly maintained or designed by the healthcare World Health Organization to codes the health conditions about the similar disease category, or also helps to code the morbidity and mortality into alphanumerical forms. And it is a specific that codes the specific conditions that are listed according to the disease categories. And it is a complex process, so that they require the different categories of disease that we can convert into this code form. So it mainly gives the unique information to the healthcare, so we can identify the diseases and according to give the procedure. So it gives the US version of ICD-10, and this mainly created by the CMS, which is a Center for Medicine and Medicinal Services, and the NCHS, which is a National Center for Health Statistics. And these are mainly consist of two medical coding set, that ICD-10 CM and ICD-10 PCS. This ICD-10 CM, which is a 10th edition of International Classification of Disease Clinical Modification, and second one is the International Classification of Disease 10th revision of procedure coding system. And this ICD-10 PCS is a classification of system that that use the medical codes that are mainly used in hospital settings or hospital infrastructure to report the inpatient procedure. And ICD-10 CM is mainly used in medical claims to report healthcare procedure. And it is standard classification that also gives the diagnosis codes, or also gives the disease condition that are related that leads to the illness or health problem. Also gives the abnormalities, then signs and symptoms, or any kind of illness injuries that are and also helps to code the diseases, the social circumstances that faces by the patient. And also gives the provide the uh, also helps in reimbursement, insurance claims, and billing purpose. And this code are mainly submitted to the payers for pay the bill, while CPT codes are mainly gives the specific information about the patient that undergoes to the when they undergo the diagnosis. So we use the specific services or the procedure that we have to implement or that are necessary for the patient injury or the illness. So the ICD-10 CM is used to the usually healthcare settings for gives the diagnosis procedure diagnosis code. And PCS mainly gives the using healthcare hospital inpatient. And there are also the ICD-10 CM that mainly gives the additional information, or that gives the health that are mainly used in healthcare settings to health or to codes the diagnosis procedures. And there are also the ICD-10 that gives the that using medical coding system, and gives the additional information, or this ICD-10 CM and PCS are mainly used in United States, and it is consist of about 3 to 7 characters. And every codes are mainly begins with the alphabet. So it is a character that gives that classifies the disease. And second and third character are the numbers. Then there are the fourth, fifth, sixth, and seventh. These are also the numbers. Or maybe it is, or maybe it was letters. And there are also some examples of ICD-10 CM codes that gives the conditions of that patient, with additional characters are also there in this ICD-10 CM code. So it also gives a specific diagnosis information or the code that gives the information of the procedure or the services we have to give to that patient. That's how we can treat or gives the treatment to that patient. That's how we can in improve in this patient's illness or the um, illness. So this ICD-10 CM and ICD-10 PCS mainly helps in hospital inpatient, so we can give the procedures or any necessary procedure that we have to perform, and also gives or helps to diagnosis the help to diagnosis the procedure, help to diagnose signs and symptoms of the disease condition. That's how we can classify that diseases, and that helps helps to pairs that we have be that are mainly used in medical claims or the billing purpose or the reimbursement for. That's something.